Welcome, Dr. Linder here. In this short video, we're going to be looking at quadrants. You can see here we have this vertical line running right down the center, and then we have a horizontal line going this way. And then we divide the body into four quadrants. We have a right upper quadrant, a right lower quadrant, a left upper quadrant, and left lower quadrant. Now remember, this is your reading left, but it is this patient's right side. You have to remember that. This is our reading right? It's your right side, but this is the individual's left arm, and this is their right arm. So this is the right upper quadrant, right lower quadrant, left upper quadrant, left lower quadrant. Why is it important to understand these quadrants? It's because in healthcare, whether you're in a hospital, a nurse, a doctor, if someone has pain right here, they'll indicate on the paperwork that the patient had stabbing pain in the right lower quadrant. And then what you would do is you'd have to go back to your anatomy days and go, what organs do we have in that right lower quadrant? Well, not only did they have pain in the right lower quadrant, but maybe they have 103 fever, and maybe they were buckled over, cramping. So now you have a little bit more of a complete package, thinking maybe that structure, which is called the vermiform appendix, maybe they have an appendicitis. If they have pain in the right upper quadrant, let's say right in here, and the history is they have pain in the right upper quadrant after eating a fatty meal, now we're thinking maybe it's the gallbladder that secretes bile that breaks down fats. So maybe there's a gallbladder issue. Okay, so understanding the quadrants is very important, and then what main organs lie in each of them. Now, besides the quadrants, they have what's called regions, and there are 9 regions. There's where the belly button is the umbilical region. Above that is an epigastric. Epi means above. Hypo means below. So there's an epigastric above the stomach, hypogastric below the stomach. Those are the regions in the center. Sometimes the hypogastric, because it's near the pubic region, it's just called the pubic region. Then, adjacent to the hypogastric, there's going to be a left inguinal region, and there'll be a right inguinal region. Right in here is the inguinal ligaments. The inguinal ligaments run this way. So you have a right and left inguinal. Then where the flanks are, there's a left and right lumbar region. Sometimes it's called the left and right flank or left and right lumbar. And then where the ribs are in the cartilage, there's a left and right hypochondriac region. Chondria is cartilage. So they're talking about the rib cartilage here. There's a right and left hypochondriac region. So you should know the 9 regions. You should also be familiar with the 4 quadrants. Okay, and then obviously the organs don't change, but now we have what looks like a hashtag here, right? You have the 9 regions, and it breaks up the regions into smaller areas, or those quadrants into 9 smaller regions. Of these, in healthcare, we primarily talk about these quadrants more than we focus on the regions, okay? But it's important to know both. This is just an overlap of both the quadrants and the regions on the same picture. And then this is just reviewing what we have in terms of anatomical reference points. So here on the top right, we have, in the center, we have our superior and inferior terminology, which is moving up or moving down in relationship to the body. But then we have the proximal and distal in relationship to the upper and lower extremities, or upper and lower limbs. Then when we divide the body right in half, there's the medial and lateral. When you're moving towards the body, you're moving medially. When you're moving away, you're moving laterally. When you're moving towards the front of the body, it's anterior or ventral. When you're moving to the back of the body, it's posterior and dorsal. in relationship to the core or the trunk. Moving to the tail is caudal, moving up to the head is cranial. Now, finishing up, we need to understand planes. Now, when we look at different types of diagnostic imaging, whether it's MRI, CAT scan, or PET scan, we typically divide the body into 3 different planes. When we divide the body into a left and right half, we use this plane right here, running in this direction, that separates the body into a left half and a right half. And what does that is the sagittal plane. Then we have another plane that runs across in this direction that will separate the body into a front half and a back half. That's called the frontal plane, also known as a coronal plane. Frontal plane or coronal plane. They're interchangeable. And the third plane is called a transverse plane that separates the body into an upper and lower half and gives you a bird's eye view of looking down into the body, so we can clearly see structures that are anterior, posterior, on the right side, and on the left side. It gives you really clear orientation of the depth of things, okay? So when we look at this MRI here, this is anterior, right? Because here's the nose, here's the tongue, here's the mouth, here's the upper lip, and here's the lower lip. Here's the cerebellum. So this is posterior. And this is either the left half or the right half of the brain. We can't really tell because they didn't indicate it. But since it's dividing the body into a left and right half, that's going to be the sagittal. Since we're looking at halves, this is probably their right half. This is their left half. Then there'd be a separation. So we're looking at from front to back or back to front. This one here is going to be the frontal, also known as the coronal plane. And then bird's eye view of the brain looking down into it. So we can see the ventricles right here, which is where cerebral spinal fluid flows. That's called the transverse plane, which is this one here, cutting the body in half this way, the transverse plane. Okay. Now, we have what's called a sagittal, a mid-sagittal, and a parasagittal. So a mid-sagittal is when we separate the body and we get equal left and right half. So here, this is separating into an equal left and right half of the body, perfectly symmetrical. But a parasagittal is when we divide left and right body, but we get unequal left and right side. So maybe here we can separate it this way, which is still a sagittal, but now we're separating into an unequal left and right half of the body. That's really the main difference. And again, remember, frontal and coronal are interchangeable, and that's going to separate into a front and a back, or anterior and posterior. Okay, now we're going to look at body cavities. And with body cavities, you can see that organs are kept in these different cavities. We see the term anterior, and we see the word posterior. We see that in the thoracic cavity, there are 2 separate cavities that fall within it. There is a pleural cavity. Pleural refers to lungs. And then pericardial, we see the word cardial, which is cardiac, which is heart. So the heart is stored here in this cavity, and the lungs are going to be in the pleural cavity. Then we have this really important muscle called the diaphragm, and the diaphragm is going to separate the thoracic cavity from the abdominopelvic cavity. And the 2 biggies that fall in there are the peritoneal cavity and the pelvic cavity. Those are the 2 biggies. The peritoneal cavity is going to be where most of your digestive organs are, and the pelvic cavity is where your reproductive organs are going to be protected. Now, this is just another view of looking at the similar structure where we have a thoracic cavity, where we have the pleural cavity for the lungs and the pericardial cavity for the heart. And then we're going to have a peritoneal cavity, known as the abdominal cavity, and then a pelvic cavity for the reproductive and urinary bladder. The brain is in the cranial cavity, and the spinal cord is in the vertebral cavity. And there's one other pathway that's called the mediastinum. And the mediastinum is where many of the blood vessels that lead into the heart and tubes that lead into the lungs travel through this region called the mediastinum. Now, when we talk about any of these cavities, there's going to be a parietal layer to each of those cavities, and there'll be a visceral layer to each of those cavities. The visceral layer is going to cover the organs, whereas the parietal layer is going to cover the cavity. So let me give you an example. Let's say this blue structure here is a balloon, and you're pushing your fist into the balloon. This layer that comes into contact of the balloon, that makes contact with your fist, that's called the visceral layer. That would be equivalent to the layer that's contacting the heart right here. Then there's this external layer, this outer layer of the balloon. That's called the parietal layer. If we're talking about the heart, it's the parietal pericardium. Peri means around. So it's going around the heart, but on the outside. Then between the visceral and the parietal layer is a pericardial cavity. That's where we're going to have a lot of fluid that's designed to cool off the heart as it's beating excessively and generating a lot of heat. Okay, so there's always a visceral layer and a parietal layer, and that holds true whether we're talking about the lungs, the heart, the pelvic cavity, or the digestive organs. So let's see, let's see if I can go here for a second. So here is the lungs. So we have a parietal pleura. This is the layer outside of the lungs. But then here on the inside, say right there, going on the inside, that's going to be the visceral layer. Okay, same thing on this side. This is going to be the visceral layer or the visceral pleura. On the outside is the parietal pleura. And then right between both is the pleural cavity. Same thing is true with the heart. The inner part of the heart on the inside, going around this way, that's going to be the visceral pericardium. Here on the outside is the parietal pericardium. And then between both of them in the white space is the pericardial cavity. Okay. So the parietal peritoneum and the visceral peritoneum, again, parietal and visceral have the same meaning, except now we're talking about the structures within the abdominal pelvic cavity, which is the GI tract. Okay. So organs that are within the digestive tract, if it's going around the stomach and only the stomach, then that will be the visceral peritoneum. If it's a layer that's just going around the small intestine, it's the visceral peritoneum. If it's a structure that's going around the entire tract that lines the entire cavity, it's the parietal cavity. Okay.